therapy that's being used is biological therapy, okay? And this therapy is aimed at changing the relationship of the body to the tumor, having the body recognizing the tumor as, hey, wait a second, you're not supposed to be here, and starting to destruct it. Now, with biological therapy, it's usually used in conjunction with other types of therapy, and most patients undergoing biological therapy complain of flu-like symptoms, okay? Usually they're given acetaminophen 24/7, and that seems to take care of most of their aches and their pains and their ill feelings of general malaise. Now, with all types of therapy, there is bone marrow suppression, as I talked before. So we really need to look at the anemias, the infections, the platelet problems, okay? Sometimes patients are given medications that are going to help with the erythropoiesis, okay? We call those hemopoietic growth factors. You're going to be given these to boost the production of those stem cells. Patients also might require stem cell transplantation, actually taking a stem cell and implanting it in the good bone marrow so that the body is able to start producing the more healthy cells. The stem cells are usually harvested either from a patient themselves, a twin, or somebody else in the audience. They're harvesting them and then they're implanting them. And when they are implanted, they're actually given IV bolus. So it's kind of interesting when you see how these stem cells are actually given. One thing you need to know is anybody with cancer, anybody undergoing cancer therapy, they're going to be immunosuppressed. So we're going to really watch very closely for signs and symptoms of any type of infection. Now, there's some oncological emergencies that I'm just going to touch on briefly. One would be a superior vena cava syndrome, where there's tumor or thrombosis in that superior vena cava. It's way up here. You're going to be looking for facial edema, occlusion of the veins of the neck. Another problem that you can see is spinal cord compression, depending on where that tumor is. It can actually press into the spinal cord and cause paralysis. Third, spacing syndrome, or changing or shifting of fluids from one compartment into another. Inappropriate diuretic or antidiuretic hormones, the pee or not to pee hormone that we have. It's going to cause changes in your fluids and electrolytes in the body. Hypercalcemia, okay, if you have a lysis, especially of bone, you're going to have an increased chance of calcium in your blood. So you have to watch for the patient for all the signs and symptoms of hypercalcemia and know what to do for that. They can also have phosphorus changes. They can also have potassium changes because of these shifts in fluid. So very important as a nurse to make sure you're assessing the patient for any type of fluid and electrolyte changes in their body. Cancer, unfortunately, causes a lot of pain. Okay, it causes a lot of pain, and over 50% of the patients with cancer have moderate to severe pain. As a nurse, it's very important to monitor their pain, to assess their pain, and to make sure they're getting adequate medication to relieve their pain. Okay, some drugs that you might use, okay, for patients with cancer, you might use NSAIDs if it's mild, opioids, okay, and you might even need to add some adjunct therapies with those. Be positive, be supportive. These patients need you. You play a very, very important role with our patients with cancers, not only to our patients, but to their families. Be positive, be energetic, and bring healing energies to your patients. Thank you very much for attending this online video of cancer. I hope it's helped. Thanks. Bye.